Okay, so I'm doing my RSV bronchiolitis pass off, and I'm going to start with the meds. So I'm in the medication room. I'm just going to verify that this is the right patient. So this is Addie, a 6-month-old. I'm just going to do my 6 medication rights first. So I want to make sure that I'm giving the right medication, that it's the right dose, that it's the right route, that it's the right reason. I want to make sure that it's the right documentation, and I want to make sure that obviously that it's the right patient, and I'm just giving the correct amount. Yeah, so we're gonna get started. I'm gonna start with, so for this patient, there's a bolus ordered. I wouldn't administer the bolus for this patient. We're gonna go ahead and make sure that the D5 that we have is all set up. And this tubing is already primed. If it wasn't, I would go ahead and prime it. So that one is ready. Oh, and before I do anything, I would just go ahead and perform hand hygiene. That would be the first thing I would do. Okay, so my fluid is ready. I'm gonna go ahead and drop my ceftriaxone, which will be IM. For this patient, it's 0.34 mLs. So I'm gonna go ahead and grab this little syringe. Right, and make sure that it's correct. 0.34, okay. Gosh, maybe. So I'm gonna go ahead and just open this. And then just making sure that I'm not touching the top because we want to keep everything clean. Okay, I'm gonna go ahead and put my needle on. Perfect. Garbage. Okay, and then I'm gonna go ahead and grab an alcohol wipe, and we're doing the ceftriaxone. So I'm just making sure that it's the right medication, again, the right patient, right dose. And it is. And we're gonna do 0.34 mLs of this. And I'm just gonna make sure that I scrub it for 30 seconds. Okay. .34. Sorry, these lines are so tiny. Okay. All right. Oh, and there's bubbles, so we're just gonna dang it. Okay. Where did my cap go? Oh, it's right there. Okay, and then just making sure that I'm just scooping the cap up. We're gonna get the bubble out, maybe. Jeez. We want to make sure we don't really have any bubbles in it. And then, oh, I was looking at the bottom of the stopper, so I'm gonna go ahead and drop just a tiny bit more because we're not quite at 0.34. That's why we always double check. I'm just making sure that we have the right amount here. Okay. Perfect. So I'm just making sure that that's, you can't really see that one, so that's 0.34.
Looks good.
Of the ceftriaxone. And you always want to double check it with someone else. Okay, then I'm going to go ahead and drop my acetaminophen. For the ceftriaxone, that is my antibiotic. This patient does have otitis media, so that's what we're using that for. A side effect of that would be rash or GI upset. So we just monitor the patient for that, make sure they weren't having a reaction. I'm going to grab my acetaminophen. I'm going to check it with the med-rec, make sure that it's the correct medication, the correct patient, and the correct dose. I'm giving 3.2 milliliters, and this is by mouth for this patient. Okay. All right. So I'm going to go ahead and use this small syringe. No, I'm not. sorry, I'm gonna use the big syringe. This would come straight out of the package, so it would be clean. And I'm gonna go ahead and do that. Okay, and this is oral. So I'm gonna go ahead and I'm just triple checking, making sure that I'm giving the correct dose, and it's 3.2 milliliters. So I'm just gonna go ahead and draw that up. Oh, maybe. There we go. That's 3.1, so we need 0.1 more. Okay, and then there's my 3.2 milliliters of my acetaminophen. This would be for a fever. And then a side effect of that could also be rash and GI upset. So we'd want to watch for that. I'm going to dump this back so that it's not just hanging out here. Okay, so we've done that. Now we're going to go ahead and do our albuterol treatment. And so that goes in our little nebulizer here. And for this patient, it's 3 milliliters. So this is a bronchodilator. So since this patient is having bronchiolitis and has respiratory distress, this would just kind of respiratory distress. This would help just open up the airway and help them to breathe better. For albuterol, you want to watch the heart rate after because it can cause tachycardia. So we just want to watch for that and make sure that we didn't give them too much. Again, I'm just going to double check my medication, my patient, my route, make sure it's the right dose. And we're doing 3 milliliters. So you're just, okay. So one of these is 3 milliliters. Perfect. So I'm just making sure that that's correct. And then I would actually wait to put this in the vial until I got into the patient's room. So I'm just gonna set that aside right here. Okay, and those are ready. So I'm gonna leave and then get gowned up and enter the patient's room. Okay, so I'm just outside the patient's room. This patient is on isolation precautions, so I just want to make sure that I'm safe and also not bringing them anything. Oh, and it's inside out, so hang on. Okay. I'm choking myself. Maybe if I can find a string, we will tie it up. Okay. And then there is no goggles for this patient. If I wanted to, I could go ahead and put those on as well. And then I'm gonna go ahead and put on my mask. Oh, maybe. Okay. Can you still hear me? Yes. All right, and then I'm gonna go ahead and put on my gloves as well before I enter the room. These will stay on the entire time until I leave the room. And then again, I would perform hand hygiene before and after putting this on. Okay, so I'm gonna go ahead and enter the patient's room. Hi Addie, I'm Lily. I'm gonna be your nurse today. So I'm talking to mom at this point. Can you tell me your child's date of birth and her name? Okay, perfect. So that matches my patient that I have. I'm just gonna go ahead and, Mom, I'm gonna go ahead and do an assessment on her. And then we'll go ahead and administer some medicine to help her breathe a little better. Do you have any questions? No? Okay. And then when I entered the room, I was observing the child. She does seem to be having some respiratory distress just from looking at her far away. So I'm just gonna keep that in mind. Otherwise, her general appearance is fairly okay. That's the only thing I can see at this time that is really going on. So we're just gonna focus on that. Okay, So I'm gonna go ahead and, my stethoscope is under my gown. I'm gonna go ahead and assess my patient. So I'm just gonna go ahead and do an overall look at my patient. We're gonna just look at her IV site, and it seems to be good and patent. There's nothing going through it right now. I'm just gonna look in the patient's mouth. I'm looking at her eyes, looking at her face, just making sure it's symmetrical. I'm gonna go ahead and feel her head. I'm just feeling for any swelling, like any weird suture lines. I'm just making sure that there's nothing abnormal there. Okay. And I can see that the patient is breathing. She seems to be retracting a little bit, so I'm going to keep that in mind. I'm going to go ahead and listen to the patient. So I'm listening to heart and lung sounds. Okay. I'm just going to go ahead and roll the patient over to listen to the back of the lungs. And you can have mom hold the patient as well. Okay, her lung sounds do sound a little diminished, and she sounds like she's breathing pretty fast. Normal respirations for this child would be 25 to 55. Her breaths are about 60 breaths a minute when I counted them. We're going to go ahead and check the rest of her vitals and then see what we can do for her. And then her heart sounded good. A normal heart rate for this age is, oh gosh, we'll come back to that. Okay, I'm going to go ahead and do her blood pressure. So you just put this on their arm. A normal blood pressure for this age, gosh, would be 55 to 70 over 35 to 55. Her blood pressure was 70 over 55, so that is good. And then we would put the pulse ox on. All right, and then this checks her oxygen. So we'll just go ahead and see what that says. We want the O2 sats to be above 90 or 91. And then we're gonna go ahead and check a temperature axillary on this baby. Ideal temperature is 37. Hers is 39, so she is experiencing a little bit of a fever. I'm just gonna go ahead and write her vitals down real quick on the back of this. Trying to think. Okay, I guess we'll come back to pulse because my brain is not working. Okay, I'm just gonna go ahead and do the patient's OFC. So their head circumference should be about 40.5 centimeters. Okay, and she is right on for that. That is good. Okay, and then we're gonna look at the oxygen. Her oxygen is sitting at 85, so I'm gonna go ahead and apply some oxygen to her, just via nasal cannula. And then we can double check how much we're supposed to do on the orders. So it's ordered at 0.5 to 2 liters per minute. To where she's at 85, I'm gonna go ahead and just put her on 1 liter. And if that's not enough, we'll just leave that on. And if it doesn't go up here in a few minutes, we'll go ahead and just bump it up to 2 liters. If it will fit in her little mouth. Okay, we're just gonna pretend that that's on the patient. And then go ahead and turn it up to 1 liter. Okay. So I'm also going to assess my patient's color. She does look a little cyanotic, So the oxygen's going to help with that. We would want to just assess if the patient's in any pain. For this patient, since she's 6 months, we would go ahead and use a flax scale. So that is just kind of checking if they're responsive, if they're like limp, their color. So this baby is crying when touched or stimulated, so that is good. I don't think that she's in any pain. She seems to be crying just when stimulated, acting normal. She's not excessively crying or inconsolable or anything, so I think we're good there. Okay. Since she's having a hard time breathing, we're gonna go ahead and put down the NG tube that's ordered and go ahead and that way we can start suction and whatnot. She also has the acetaminophen ordered, so I don't want to give that right through her mouth. We'd have to give it through the tube because her respirations are so high. We don't want her to choke on it or aspirate. Okay, Mom, so this is just a tube that's going to go down her nose. And so some medicine can go down there and going to help her be able to breathe. And so we can administer stuff through it. So this would be in a clean package. Well, there's 2 of them. Hang on. So maybe we'll use this one. We're going to go ahead and use this other tube because it is in a package. Okay. So this is a clean procedure. So we would just want to make sure that we stay clean and do our best not to obviously touch it on anything. Okay, we're going to go ahead and set that right here. And then on the infant, oh gosh, I'm trying to remember. You would start at the nose, go to the ear, and then you measure down to about here on these guys, I believe. Okay, so we're just gonna make note of where that should go. Okay, I'm gonna go ahead and just spray this tube. Oh, maybe we'll do it over the garbage. Okay. All right, and we measured on that. Okay, it looks like this is the nostril that works. So this is not painful for the baby, Mom. We're just gonna go ahead and insert this. She is gonna cry, obviously. Something's going down her nose. I'm just gonna gently insert that. And then we wanna make sure that we're going right in. Okay. All right, perfect. And then it stops right where I measured it at 16, so that's perfect. I'm gonna go ahead and, we don't have any tape, but I would go ahead and we would go ahead and just tape it right there. That way it's not just like gonna fall out or anything. Anyway, so we would do that. I would aspirate a little bit of contents into the tube. We're gonna go ahead and check the pH, and then we would go ahead and send the patient for a quick x-ray just to verify that it's in the right spot. So we're gonna go ahead and put that in. Oop, maybe. Okay, and then I would dip it. Okay, and it looks good, like it's in the right spot, so that's good. Again, we'd verify with the x-ray. They would do that. And then I'm just making sure that I'm recapping the end every time I'm done, so we don't expose her to any infections. That way. Okay. And then this patient is on suction, so I'm gonna go ahead and hook that up now, just because she is having a hard time breathing. And I'm gonna alcohol the end of this just to make sure that it's safe before we hook it up. Okay. And then we would just hook it to the suction, and we would alcohol that as well, just to make sure it's clean. Oh. Okay. Maybe it doesn't want to stay on there. Okay. All right, so we're just gonna pretend that that is, oh, maybe it will stay now. Okay, so that's connected. We're gonna go ahead and turn that, it says, I believe, low to intermittent suction. Okay, so it's PRN suction. So we're just gonna go ahead and turn it on low intermittent suction. We're just gonna let that run for a minute to kind of help her breathe and get those secretions broken up a little bit. Okay, so while she's doing that, I'm gonna go ahead and get the albuterol ready. Okay, so this is my 3 milliliters. Again, I'm just checking the patient. I would explain to mom again what it's doing. So mom, this is just to help open her airways. We're gonna monitor her for rash after. Just make sure she's not having any reactions. So I would go ahead, and for this patient, it's 3 milliliters. I'm gonna go ahead and, oops, maybe it doesn't open. Pull that off. Maybe. Okay. I hope that doesn't just fall right out. And then I would go ahead and pop that off, and I'm gonna go ahead and dump it in there. Okay, and that's my 3 milliliters, which is what was ordered. And then I'm gonna go ahead and screw the cap on. Okay, perfect. And then I'm gonna go ahead and turn the suction off for a minute. We don't want it on while this is running because it can just, we want the patient to breathe it in. We don't want it to go right out. So I've turned the suction off. We're gonna go ahead and hook this up to her oxygen. So we would just I'm taking the nasal cannula off and I'm hooking this up instead. And then we can have mom hold this. Do you wanna hold it? Okay, so mom's gonna go ahead and just hold that on the patient's face and make sure that she's not fussing and that she's getting the appropriate amount. If the patient was not tolerating the mask, we could do it via blow by, and also the patient can hold, or the parent can hold it for that too. We would just hold it close to their face, but she's tolerating the mask well. I'm gonna go ahead and take this off. Okay, and then the normal patient's heart rate, I want to say was 55 to 90 beats per minute. This patient's was 80, so she's good. To administer that, we would want to monitor for this medication. The albuterol can cause tachycardia, so we want to make sure and monitor for that. But she seems to be doing good so far, so that is good. Okay, while that's going, we can go ahead and administer the acetaminophen. That would be our next priority since we're administering the bronchodilators. Now we can go ahead and administer the acetaminophen for the fever. Okay, and that's the one that is PO. Which obviously she's breathing pretty fast, so we unclamp the suction. We're gonna go ahead and administer that through her NG tube. Okay, I'm gonna scrub the hub of that. And then I'm gonna scrub the top of this. Typically this would be in a clean package. And then I would go ahead and hook that up and administer it through there. Okay, and then you would just make sure that you just push this slowly. Probably over 2 to 5 minutes just to be safe. And then we'd watch for effects. So I would recheck her heart rate here in about 10-15 minutes just to make sure that it's not faster than it should be. Okay, we're going to administer the ceftriaxone. So this is just an antibiotic for her ear infection that she's experiencing. And this is IM. So we're going to go ahead and get that ready. And I would just do this about right here on the thigh of the child, and I would make sure that I was just squeezing it, and then we'd go ahead and inject it. So I'm gonna go ahead and scrub the site. And I wiped her leg. I'm gonna go ahead and let it dry. And if mom wanted to hold the child while this was going on, she could. It would make her better. And I already scrubbed the leg, so I'm not going to scrub this. And then I'd go ahead and just inject the medication. And again, I would just push it kind of slow, not super fast. This one we don't want to do too slow because they're not going to tolerate that super well. I just put my safety guard on, and then that would go right in the sharps in here. And we're going to save the syringe. Okay. And then with that one, again, we're just going to monitor for rash as well. Make sure she's not having any reactions. Some of the other orders we have for this child. So we would do, she has no known allergies, and we went over that before we did the meds. And vital signs are going to be every 4 hours and a blood pressure every 12 hours. We did the blood pressure. The breast milker formula can go through the NG tube. Since her breast respirations were kind of high, we would probably opt to feed her through the NG tube. So when she's hungry, mom, call us and we can help you with that. The head of the bed is elevated to 30 degrees. We applied the oxygen. We did the suction, which we can continue the suction after about 30 minutes of the medication being done, just to make sure that the patient has got it and it's settling. The labs, we're just going to check her electrolytes. We're going to check her arterial blood gas and then her nasal viral panel, which they did in the ER. We did the x-ray to verify the placement of the tube. And then, we're going to go ahead and hang the fluids. We should have done that. There. Okay. So this is the D5. We're going to go ahead and hang this. This just kind of is going to help keep the patient hydrated and maintain fluid balance, especially since she's not really eating a ton and not feeling super well. We would place this on a pump. We don't have one right here, so we'll just pretend. And then we would set the rate for 27.2 milliliters per hour. We use that doing the 4-2-1 rule, using her weight. So I scrubbed this hub, and then I'm going to go ahead and scrub this one as well. Okay. And before I do anything, I'm going to grab a saline flush. I'm just going to set my cap up over here. And I don't need to scrub this because it just came right out of the package and it had a cap on it. So I'm just going to go ahead and flush a little bit. We're just making sure that her IV is patent. Okay, and it is. Perfect. Okay, and I don't need that. So I'm just going to set it down. I already scrubbed that one, but we can scrub this again. Just to be safe, we just want to make sure we're maintaining patient safety, obviously. I'm going to go ahead and scrub those. Okay. And hook it up. And then I would just make sure that all of my valves were open, which they are. Make sure that it's running at the appropriate rate, which again is the 27.2 milliliters per hour, and it is. And then I would just monitor my patient. I'm going to reassess her breathing and make sure that it's getting better. Ask mom if she has any questions. Do you have any questions? No? Okay. And then this medication's done. So we would wait probably at least a few minutes. I'm going to say like half an hour to let that medication set in her belly before we turn the suction back on. Her respiration seems to be improving, so that's good. And her oxygen was brought back up to 94. So I'm going to go ahead and we would probably just leave this on her the whole time. Just going to make sure. Just going to look at her history again to make sure we got everything. And then again, just with RSV, we want to make sure that we're keeping you guys clean and not spreading it to anyone. It is spread by air, so we just want to be careful. The patient does seem to be improving. We are still going to keep her here for a while just because RSV causes a lot of respiratory compromise. And we want to monitor her for that and make sure that she's breathing okay and that her airways are open. Do you have any questions? No? Okay. All right, I'm going to go ahead and go, and then I'll be back in a few minutes to check on you guys.